Hi, this is Peggy with Natural Awakening Chicago Magazine, and I want to welcome you back to our Women in Wellness series. All through May and into June, we are speaking with prominent women in wellness in the Chicagoland area. And I am so pleased to be here today with Reneé Barasch, aka the Tummy Whisperer. Welcome, Reneé.
Thank you, Peggy.
I feel like having the strobe lights going over. The Tummy Whisperer has entered the room.
Wouldn't that be something?
So
Oh,
for our viewers who might not know who the Tummy Whisperer is, tell us a little bit about what you do.
sure. Well, as a tummy whisperer, coined by a colleague of mine, I am a certified digestive health specialist, which means that I help people with their digestion and their gut and things related to digestion, which are oh so many things as we know. So we're looking at specific digestive, gas and bloating, the typical run-of-the-mill bowel issues, those type of things are obvious to people that their digestion is off. But what some people are not making the connection to possibly is other issues very much related to how your digestion works. And that could be hormonal issues, that could be hair thinning, that could be skin issues, sleep issues, cravings,
Mhm.
all kinds of things that go bump in the
Allergies.
night. Allergies, a big one, especially this time of year.
Mhm.
So when we look at digestion, and how I look at it as a digestive health specialist, is not only what's going in, how's the body digesting what's going in, how the body is absorbing what's going in, and how the body is getting rid of waste at a cellular level. And while that all sounds really nice and neat, there's absolutely a hiccup in any one of those parts of that chain, which can cause symptoms for people.
Mhm.
So that's the nutshell in what I do.
Yeah, so you help people build a strong foundation for good health by addressing the digestive system.
Exactly, exactly.
And the digestive system isn't necessarily all our tummy. It could be the whole gut, it could be elsewhere from your mouth on.
We don't think about it too. I always tell people that your organs in your GI tract and all of your organs actually, in your body are
Mhm.
like a big subdivision sharing the same plumbing. So, sometimes you can get some bacteria in the gut that also can go into different parts of the bladder and into the colon and things like that. So everything's kind of swimming around there, and different types of overgrowths can affect different parts of the body, which again is related to how the body's managing what's going in. Can the GI tract be strong enough to be balanced enough to fight off some of that stuff and help the rest of the body along?
Yeah. Well, we've been focusing on women's health, and obviously you treat people of all ages, men and women, but women specifically. Um, when you and I've talked recently, you've mentioned a lot of women have some bladder issues, UTIs, bladder pain, etc., that might actually come back to the gut and what they're eating as opposed to an infection.
Absolutely. And sometimes it's both. Sometimes it can be a perpetuation, which can lead to an infection,
Mhm.
especially since 80% of your immune system lives in your GI tract, right? So if we're not digesting and regulating our food, that bacteria can proliferate and grow and certainly affect other parts of the body. But I have to tell you, I've just come across so much urinary bladder stress with not only female clients but male clients as well, and kids now too. I just recently started working with a young boy who's got some urinary urogenital issues, and while his diet isn't great, we're working with him. I just started working with him about 2.5 weeks ago, and while we're waiting for lab testing to come back, we've just changed up the diet a bit, and he's already noticing that he's feeling better. So I myself had struggled with some bladder issues years ago, and I received a bladder diet from the doctor, which I was really pleased that a medical doctor was like, don't eat bananas or, whatever. At least he was trying. But I'd already been working with that diet myself prior. But it is really important because people don't think about food as chemistry, and it is. It's your chemistry of what's going in. So that again can affect, so many parts of the body. As far as infections go and bladder infections, women or people will run to the doctor because they've got the pain, they've got the urgency, they're taking the cranberry pills, or they're just so desperate for something, and the doctor will just automatically put them on an antibiotic even while they're waiting for the testing to come back. 60% of the time it's helpful to at least get that relief. The other 40% of the time, it doesn't really do anything, or it could perpetuate the problem and make it worse, because as you take antibiotics, that knocks out your microbiome. There's a vaginal biome, your bladder biome, and you want to have that same kind of balance.
Yeah.
So again, it's the same project. We're looking at here and what's going in that's affecting those parts of the body.
Mm-hmm. Well, you're a certified digestive health specialist, and you've been practicing for more than 15 years. So talk a little bit about your journey. How did you get to this point? You take a very scientific approach to working with your patients. Obviously, you've developed this over time.
Yes, in fact, 17 years to stand corrected.
And over 15.
It's over. You did say over 15. Well, I started, it was pretty innocent. I have, my career prior to becoming a digestive health specialist was spent doing soft tissue work as a massage therapist for decades. And I have a very, very dear friend of mine who is a chiropractor and was using Dr. Loomis's system, which is where I was trained, the Loomis Institute of Enzyme Nutrition. And I didn't realize I had really digestive issues until he wanted to practice this Loomis technique on me. And so he started me on some enzymes. I ran the urinalysis, and I had noticed that I maybe was having, bowel movements a few times a week, which is not normal. You should be having them every day, 1 to 2, for a healthy body. And I had noticed that all of a sudden I was having bowel movements daily. And I thought, oh, that's interesting. And pretty quickly on, I also noticed that my energy was kind of coming back. And this is, 18 years ago. So we have 18 years on the clock to add to the low energy and the stress of life. But I also noticed, very interestingly, my sleep was wonderful. I was sleeping soundly. I was waking up feeling refreshed. And then the biggest kicker of all was my hormonal acne that wasn't bad. It was only happening during menstrual cycle time, was gone. And the sugar craving seemed completely quelled. There's a 4 o'clock Snickers craving that would happen daily. I'm embarrassed to admit, but it just went away.
It was 18 years ago.
It was 18 years ago, and so I thought to myself, well, I understand like the component of eating well, but eating well is not enough. You have to digest what you're putting in. Without that digestive piece, you don't have the absorption, you don't have the elimination, you don't have really any of it. So it light bulb went on over my head, and I thought, I want to learn more about this. So I ended up going to the Loomis Institute of Enzyme Nutrition and taking his coursework, his curriculum, and voila, here I am.
And so now you're practicing both telehealth and in a couple of offices in person.
Yes. I am at North Shore Proactive in Libertyville with Dr. Jordan and Jade Leisure. And I'm there on Mondays and Wednesdays. And Dr. Jordan Leisure is also a functional medicine doctor. She's wonderful. She specializes in hormonal issues, chiropractic, of course, as well, and something I want to touch on as well, too, in a moment. And then I'm also, of course, doing telehealth as well. But so Dr. Loomis, for those of you who don't know and may want to look it up, is a chiropractor. So my training from the Loomis Institute was not only based on the chemistry of nutrition, but the structure of the body as well, and how it translates into the body. And what happens when things aren't working properly. And specifically, a rotated neck vertebra or a low back issue or a hip issue, and how that can impair and impede the functionality of the body.
And so the digestive system.
Namely the digestive system. And,
so I would imagine, and that would be nerve interactions and
nerve interactions, definitely. I always tell people, think about your circuit breaker, right? The fuse is blown, you're not going to get the lights on. So how do we turn the lights back on? We get that chiropractic method in there to help really pressure off the neck and off the vagus nerve to help the diaphragm fire. And without proper firing there, nothing's going to get the message at all. So we're really looking at that structure component being a big piece of it. I would say collectively, over the years, I've had many of clients call me with a severe acid reflux, and that could be one of a million things. But one of the common things that comes along with an acid reflux, having to sleep up at night, is a whiplash. A whiplash, a neck injury, pressure on the vagus nerve, pressure takes the pressure and puts it, translates it on down through the digestive system because that circuit breaker is blown and we can't get the lights on. So it's really important to take care of your physical, your the chemistry and the structure as well too, and then the emotions as well too. So we look at all of that. I look at all of that for sure.
So looking at the world in the last year and a half, which is a big statement right there, what, as we're coming out of the pandemic lockdowns and the state of Illinois is moving towards opening, what have you seen shift? What are you noticing in health, especially in women's health, in how people are caring for themselves, or what their concerns are, and where should we be headed right now?
That is a really great and loaded question, but I'm going to answer.
We got 2 minutes. No.
Well, so the answer is people are absolutely more aware. And the first side of it was when people were home, they were doing one of two things. They were either, throwing down in the kitchen and whipping up great healthy things and learning how to cook healthfully and mindfully, or they were going the other direction and drinking beer and having Twinkies or whatever it is. And I've had so many people tell me I've got my COVID weight. It's their COVID belly. But there's been a fear, as we know, and some of the fear is a motivator for people. And what I see is people are motivated by that fear. They don't want to get COVID. They don't want to get anything. So they're going to try to make some effort. Now, that doesn't come along without them having some symptomatology, because if you're just feeling good, there's no motivation to really do anything. So these symptoms are starting to show up with people as they're eating poorly. Now, some people have a very robust digestive system and they're very healthy and they can eat a bunch of crap and it doesn't bother them. And I'm always very jealous of those people. But, it does catch up with you. Where I feel we're headed is in more of a mindful state, so to speak. I see a lot of things on Facebook and a lot of, ads about prevention, which I love. And I think even some doctors are trying to look at, some of the good doctors are trying to look at some preventative measures for their patients. I know that some of the medical doctors that do concierge will, talk about a water intake with their patients. So are they walking 20 minutes a day, which is wonderful. You don't really hear the doctors talking about how are you taking care of your self-care. So the self-care is the critical piece, and we should be doing it anyway, pandemic or not.
Yeah.
But I see people becoming more aware of it. And again, that fear piece of they don't want to get that or anything else. So they're really taking action. I have seen a nice trend of people really wanting to take care of their health and make sure that they're strong and healthy for the remainder of their time here on this earth. So that's been a really pleasant surprise and shift for people. But I think a lot of people don't know where to start too. And collectively, I will say they have some pain, they go to their doctor runs some tests, they don't really see anything, and they're still left with their pain, specifically digestive pain. And when you don't have an answer and you're left with, well, what about food? The doctors don't know how to help them with that part. That's a great place for me to have a conversation with somebody and where I can help them with some of the chemistries and what may be, causing some of their possible symptoms.
Yeah.
Yeah.
And something that might not have bothered them in the past that they're eating now might.
Well, and that's the thing. People, I hear that a ton. I've been eating this for years. Well, the body only has a small window of tolerance where, you can only handle so much stress. So here, when we're young and we're infants, we got this big window. And as we age and as stress happens and as it happens and we get older and we get thinking that, right? The window of stress, the tolerance closes till all of a sudden the body starts to show symptoms. By that time, things are already way off the mark. So you want to make sure that before symptoms creep up, you want to make sure things are pop the hood and everything's plugged in and working well. So
one more quick thing on symptoms I want to bring up, because we are heading into summer season.
Yes.
And there's all sorts of wonderful things out at the markets, but you've written about this actually for Natural Awakenings, which is I hope I'm saying this right, the oxalic acid.
Yes.
And how certain fruits especially could trigger some allergic reactions in the gut that could cause things that are not easily tracked down.
Yeah, so oxalates are a big thing that people aren't really aware of unless they've been diagnosed with a kidney stone, and that what their doctor will mention
Mhm.
possibly. But yeah, there's oxalates in a lot of vegetables and fruits. So people who go to start trying to eat healthy and are doing juicing and things like that, and they're feeling worse, it's because of the oxalates. And oats as well can be another one of those contributing factors. But again, looking at how well the body's balanced and
Yeah.
from the mind to the what you're putting in can also help the body withstand some of that stuff. But if there's a vulnerability to that, and it's definitely related to histamine intolerance too, those histamines can trigger with the oxalates and cause a chemical Molotov cocktail that is not helpful at all for the body. So it's a matter of what you can tolerate too. It doesn't mean because a food has a high oxalate you can't eat that. There's a balance. How much can you tolerate, and at what time of the year,
Yeah.
right? We talked about that. Wintertime for me, I'm able to have a little more histamine because there's less histamine in the air. But this time of year, I'm really careful and really dialed in with my diet for sure.
Yeah. And what's the combination? Like I said, the histamines in the air, maybe you're eating a lot of nightshades, tomatoes, peppers, potatoes, etc.
Right.
And then you're layering in other things.
That's it. The layering. It's like yeah, the straw that broke the camel's back. The body can only take so much until boom, you've got a symptom, and then at least you have something to work with.
Yeah.
But you don't want to wait till that point, folks. You want to,
So
be proactive. Take care of your health, your physical health, your structural health, your chemical health, and your emotional health. They all feed off each other for sure.
yeah. So if people want to learn more, if they want to reach out to you, the Tummy Whisperer, what's the best way to get in contact with you?
They can go to thetummywhisperer.com. They can call or text directly to 847-207-2034. Either is fine. I'm ready to talk to whoever wants to ask me some questions about things that have been going on, and I would love to help you in any way that you see fit.
Great. Well, thank you, Reneé. It's been a pleasure talking with you today. Always learn
Thank
something, always learn something new here.
Well, thank you, Peggy. I appreciate the time. I appreciate the opportunity, and wishing everybody good, well, and radiant health, and you as well. Thank you.
Great. Thanks, Reneé.
Thank you.